The levator scapula attaches down here on the scapula on the superior end of the medial border. And then on the upper end it attaches to C1, 2, 3, and 4 transverse processes. And it comes down here and there's a twist in the muscle right there. So you can visualize here the edge of the neck and the top of the shoulder, and there's levator scapula. We're going to be working first on this end, on the lower end, pinning that muscle and then stretching the insertions towards the belly of the muscles. Then we'll come up here, pin right up here, and stretch those muscles downwards. First we need to identify its location, and I can find the lower end of her scapula most easily. You can see it on her, it's fairly obvious. Some people it's not, and especially I might even have it covered like that. So I can take my soft hand and run it over that area, and the corner pushes right up into my hand. Notice the difference between doing this and going like, now where is it? This is pokey, this is not good. But if you take your soft hand, you'll find it right away. And then you can follow, and here's the edge here. But I'm following it through the sheet because my hands slide more easily through the sheet than they do. I have to be a little bit more aggressive, and I'm actually starting to lose it when I go straight on the skin with the oil on it. And up to here, that's where the superior medial corner is. So the levator scapula attaches right here on the underneath side of that bone, and it runs up here. So I'm going to give a compression and then a traction. And you can see I've used the towel in order to get a better engagement on that muscle. This hand I've put to the lower end of her scapula, so I push the whole unit up. Compress it and shorten it. Compress it, get a good engagement, and shorten it. Notice that this arm is straight. My chest is up and open. Look at the difference between if I were to go in here like this, which gets pokey, versus if I keep my chest up and open, straighten that arm, and then push from there. So I have more distance from her, which means she has access to all of this space. If I were to lean over like this, on an energetic level, she would feel me there and would likely contract. But by keeping this position, she's more likely to relax and her muscles expand. Look also at my feet here. I have one slightly forward from the other one. And when I do this, my weight is shifting from my back hip to my front hip. So I engage the tissue, bring my hips back, and then push forward and hold. Engage the tissue, lock it in here, my hips are moving back, and then my hips push me forward. You can also get that levator scapula from the upper ends, right from the C1, 2, 3, 4. And so with this, I'm just going to use my fingertips, and I'm going right to the side of her neck. This hand, well, I engage the muscles here, and I use this hand to push her head and thereby shorten those muscles. And the movement I'm doing is about this big. It's a tiny little movement coming right in by the transverse processes. Then again, if you look at my full body, my chest is moving away from her. I engage this spot, and as I push with my hand, my whole upper body, actually, and my hips too, move away from her, so that it's a reaching movement. And notice the difference between this, where I lean in and it becomes more aggressive, versus this, when I lean back and it's a gentler move. When it's a gentler move, her body will trust me her body trusts me, it may let go. If she has to guard against my aggression, she's going to tighten up. Good. You can also work compression traction right here on the suboccipitals. So in this case, I'm using sometimes my thumb, or this case my middle finger. Compress right at the edge of the occiput, and I'm pushing down towards her lower body. This hand is then is lifting her head slightly, her skull. So the two hands are working together. And again, I'm in a standing position. My legs are relatively straight. As I compress into those suboccipitals, my chest moves away from her. My hips move away. Optionally, if I want, after I move away, I can move back in. So here's the move away. Pause right there. And then, if I want, I can push back in. I don't have to. I can just leave it at just the moving away because that's gentler. So this is compression traction for the suboccipitals with the client in a prone position.